We will be starting with the building the pyramid research, a structured approach to evidence-based practice. As we all know, before going to the content, as we all know in the healthcare research, we always go for an evidence-based practice. It is not only the research when we go for any practice. So when we go for a research or any clinical practice in our day-to-day life, no matter it's a physiotherapy practice, it's a medical practice, or it's a dental practice. So whatever practice we are doing in our healthcare professional life, it is based on the evidence-based practice. So nowadays, research is also one of the common and very important protocol what we have to take as an academician, as a researcher, or as a student. As we all know, like we have started the research from our graduation level, we do the research projects in our UG level, then we do the master dissertation in our PG level. But sometimes we are lost, like how we have to gather the information to get a good research content, to do the good research, or how we can get a structured evidence-based practice when we are in practice. So that's what we are going to discuss it today. So before we start, so actually what exactly the research means in our day-to-day life. So when we talk about the research, it means that you don't know, but you're willing to find something else. So it will be very common for all the fellow mates who are sitting there, maybe the UG level or the postgraduate level. When we go for our dissertation or when we choose our research, we go and meet our supervisor. So we tell the supervisor or guide, what we call as, we tell them like we are under your guidance. So what the supervisor says, okay, go and find the topic, get some topics to me, come back to me, I will see. So that time, a new researcher, a new student is completely lost. What exactly I am supposed to do? From where I will get the content? How will I formulate my research question? And sometimes the research supervisor says, you just have to get me a mother article, which is an evidence-based practice. So in that time, as a student, we are lost. We don't know how exactly we are going to get the content to go back to the supervisor and to give him or her a good sound of study. So, when we talk about research in healthcare research, it's rapidly growing. To be honest, my dear students, my dear colleagues, my dear seniors, my dear professors, who all are there sitting there to listening to my talk, research has become a very rapidly growing field in all healthcare processes. No matter we are a student, we have to produce a research to complete our degree or to complete our dissertation or to fulfill our degree. So when we go for as an academician, we work as an academician, we need to give the evidences of research, we need to publish some researches, or when we are teaching students, we need to teach students based upon the evidence-based practice. So evidence-based practice is become a day-to-day life practice in all healthcare professionals. So when we go for a day evidence-based practice, how we are checking for the literature, how we have to know what exactly is the evidence-based practice. So evidence-based practice has come from the clinical literature review services, which we have different information we gather from the different sources, like we have different search engines, like we go for scopus index articles, we go for PubMed index articles, we go for all kind of gray literature or non-gray literature. The gray literature, what I mentioned, is which is published, the non-gray literature, sorry, published, and the gray literature is we go to any PhD thesis, we go to any master thesis, we go to universities or the institution levels to check what are the researches have been done, to find what was the evidence they have proved. So based on that evidence, we collect some of the information through which we can reframe or reform our study or our literature or our research to make it as an evidence-based or a structured research pyramid. So intensively, we collectively understand the topic and contribute productively. And to achieve this, one must begin understanding the context of the conversation. So when we are starting with the topic, yes, we should know we have to collect all the researches which are evidence based, which are published in a good index journals, and then only we can understand the topic, then only we can contribute to the productivity to perform a good research which can produce a good clinical existing evidence based literature. So, when we talk about the research, it is very well said by Robert Babbage. He said, research is a systematic inquiry to describe, explain, predict, and control the observed phenomena. So, if you just look at the picture at top, you can see. Okay, so when we are talking about the research, so we need to know what exactly is our inquiry. So whether we are finding the right answers, whether we are finding the right results, and whether we are getting the exact solution of our problem, which can be in future in the field as evidence-based practice, or whatever content we have taken as a literature from the previous research, whether it's an legible or an advocate evidence-based practice. So coming to the phenomena, how we can just take this phenomena of a research. Research phenomena can be any problem. It can be any issue or it can be any topic that is chosen as the subject of an investigation. So sometimes in our day-to-day life, we also use like, okay, fine, friends will be just talking with the friends will be saying, okay, I'm doing some kind of research. Maybe, like I'm just giving a very, layman example. For example, I'm just looking for some good content of my attire. So I will tell one of my friend, I'm just doing some kind of research in which color matches my skin tone and what color shade will be good and what kind of pattern will be good. I'll be doing some kind of research. So in that research, it is not the topic or it is not the subject what we are choosing. It is also called a research. But when we are doing a research in healthcare, when we are producing the evidence-based practice, we need to know what exactly is the problem in the previous evidence-based practices, what we called as lacunae of the research or the gap of the research. So we found, yes, that was the problem. So we need to get that problem into our hand and to know how we can find the solution out of this. So, well, we are doing the good research. Any researcher who is doing a good research, or being a student, we are doing a research, or being as a faculty member, we are doing a research, or being a PhD scholar, we are doing a research. We should always understand what are the characteristics of research. So, it is all over connected with the evidence based practice, whatever we made a pyramid of our research. Research should be always reflective and should be self critical. So it should be replicable and it should always be cyclical. So these are the characteristics of the research. So we should always have a vision, we should have an imagination, we should have a creativity, and we should be always an innovator as a researcher. So these are some good characteristics what as a researcher we should find to get a good pyramid of research and to find the best evidence in the practices. So now the question will be, how could you help me? Okay, you must be asking me, how could you help me to get all these things? Yes, I will be helping you to get all these things by going to the next slides. Is we should always gain to understand the hierarchy of evidence and applying it in practice. So many researchers are publishing in the journals which are predatory journals. We just publish. We have something in hand, we just publish it, and the predatory journals take it very happily. We pay them some amount of money, we pay in dollars or we pay in INR and to get our research published. But that cannot be a good guide or the understanding of our practice, because that is the fake research. Because predatory journals take the researches where we have the falsification of the data, where the ethical considerations are not taken care, where the scientific command of the research is not appropriate, where the evidence of the practice in our literature is not mentioned, where our gap of the study is not appropriate. So why evidence based practice matters? It matters because it has got an importance in healthcare. It has got an importance in policy making. It has got an importance in professional decision making. It improves the outcomes, it enhances the reliability, and it promotes the informed decisions. That's how we are doing evidence based practice. We have many subjects like clinical based case studies, we do evidence based case studies, we do evidence based practices in healthcare professionals. Okay, so that is how we go and make a good research pyramid. So I'm just changing the slides accordingly, but in meantime, I'm not reading only the content from the slide. I'm just talking. If the students are having the notes with them, they can take down the notes because I'm not just reading the slides alone. All right. So, the understanding of research pyramid. How do we have to understand what exactly is the research pyramid? The research pyramid should have an hierarchy of evidence. So, when we are taking an evidence, from the literature, we get lost. As a student, we get lost. Sometimes we go and we just take the studies and show to the supervisor, which is always only the sometimes only the case reports, or it is only the randomized control trials. But my dear students and my dear friends and colleagues, we should always take the evidence based practice as per the hierarchy which I have mentioned over here. The top to the bottom, it is between the as per the chronological order. Like first and foremost, the higher indicates the stronger evidence is the systematic reviews and the meta analysis, which has gotten greater weightage when we are giving some kind of evidence based practices to make our research pyramid very effective and very good. The next comes to the randomized clinical trials or the randomized control trials. And the third one is the cohort studies, followed with case cohort studies, cross sectional studies, case reports, and experts' opinions on editorials. So, when we want to make a good research pyramid, we want to produce a good clinical practice by evidence based practices. So, we need to have a stronger evidence utilizing all the levels from top to bottom. Now, we have collected all the evidences, we have collected all the literature from the research pyramid, which from the higher level to the second level. So now we are going to make a research proposal. Now you will be asking me, like, we have collected it, but how we are going to do the research proposal? Because it's really difficult, because I have gone through this as a student. It's very, very difficult when your supervisor says you go and find this topic, and when you have no knowledge about the research and how you're going to do it. So we should always formulate a research question first. If you want, you can just take the screenshot of this flowchart. So the research question is something like which arises a question in our mind, in researcher's mind. So how does that question arises? The question arises when we are reading about the literature which is already supported the evidence-based practice, which I already mentioned. Like we have to take a good source of content from, we have to have a good source of search engine to get a good content so that we get a good research question. So for example, somebody wants to do a research on osteoporosis, or somebody wanted to research on osteoarthritis, but we don't know what exactly is our research question. So when you just dig into the research question, that is research key component is osteoarthritis, physiotherapy management, recent evidences or evidence-based practices. So you will get a number of research articles in your system. So once you read the articles, obviously you will find some gap in the study. Maybe somewhere, I'll just give you an example because there are some third year students also here, which can be very helpful for them to formulate a research. When we are just taking the content, then finally we just find how would we take that as an evidence-based practice. Sometimes when the research is done, for example, it is done.
So when we talk about the research question, so when we are checking with the previous researchers, sometimes the research is already done in one population. For example, we have done a study on South Indian population. The same study can be taken in the North Indian population or the West side or the east side, stating that there can be some regional disparity, there can be some heredity things what you want to check, or there can be some regional things you want to check as an evidence based practice. Or sometimes if the study is done only on one gender, for example it is done only on male gender, and you can take the same study and continue it as doing in the female gender. So to produce that best clinical practice or the best evidence based practice based upon the region, based upon the population, or based upon the gender. So this is how you need to formulate the research question. All right. So next is the literature review. So when we are doing the literature review, why we are doing literature review and how we should do a literature review. So we should do the literature review on topic, the same topic what you have chosen, it should be relevant, and you should search for the literature on method also. That is what methodology you are approaching or what methodology you are taking for your study. Or you should also take for a theoretical approach. Theoretical approach is something where it is proven as theoretically, not the scientifically. So we need to find a hole, that is take a research gap, what I already mentioned earlier, how we can find a research gap, and look for the debates. Look for the debates is you need to have the critics of your own research question, which I mentioned in the earlier slide also. Maybe you can have a peer discussion, you can have the discussion with your supervisor to reframe your research more refined. Now, the third point is the methodology, how we are going to do the methodology. Sometimes we just adapt the same methodology what the previous researcher has done, we just take the same methodology and apply to our research, which is completely wrong, which is not ethically right, which is not scientifically right to take the same methodology. Now, if the methodology is a standard methodology, has been standardized, we can take it, but we need to add some more component to it based upon our research gap, what we have found in the clinical practice or the evidence-based practices. We can implement that to make our research more good in the field. So we need to check about the research design, what kind of research design we are choosing for our research, which is part of methodology. What are the research procedures we are going to do? What kind of data we are collecting? And what kind of collection procedures we are doing? So research design, usually we have two, qualitative and the quantitative research. Whether we are taking the quantitative or the qualitative research, under which, what kind of research, whether you are taking, whether you're going for a cross-sectional, you're going for an randomized control trial or cross-sectional studies, or you're going for in systematic reviews, narrative reviews, or you just want to have some other kind of original studies. So kind of data, when you're taking the data, it should be very precise what kind of data you are taking. So when we are taking a research topic, we'll be very enthusiastic and we'll be very happy, fine, we got the topic, this is the best topic, my supervisor approved it, and this will be the best study. But without knowing how I'm going to have the participants in my hand, whether I will be having access to those participants, whether there can be any ethical statements, what would be the cost and fund of my research, whether the human participants in this research will be willing to take part in my research, because these are very critical points as an ethical issues which has come to from the Belmont report, which has ethical considerations have given for each and every research that we need to take care when we start our methodology, right? That is also one of the basic thing we check as an evidence based practices, as in clinical based practices, because when you are to have a good evidence based practice. So preliminary data is something like when we are taking the preliminary data, we are just checking for the evidence of importance, we are checking the statement of limitations and the contributions. So this is how we need to follow the research proposal flow chart, which will give us a complete pyramid of a research and which will support us a very good structured evidence based practice in our research. Now, coming to the next point, how the good research should represent, how we are taking a good research, what are the considerations we have to take. So I have just quoted some points over here is finer maps. Is this slide visible? So good research is represented by acronym that is finer maps. So how we are going to take the finer maps? The finer maps is something like F stands for feasible, and I stands for interesting, and N stands for novel, E stands for ethical, R stands for relevant, M stands for manageable, A stands for appropriate, and P stands for potential value and publishability, and S stands for systematic. So, if you just take this finer maps into consideration, so you think you will be amazed to see the result of your research, which will be a good research. So, feasible first thing is one has to have an access to the people. As I already said, we should know who will be my participants in my study, whether I have the feasibility to access to those people, whether I have are no more to get the funding from the university, we have no funding from afford it. So that's very important. We do this study not only for the gadgets, we have some kind of instruments which are very expensive, but we don't have that provision in our university or in our institutions. So again, we are at lost when we are at the data collection time. So it is our responsibility to know whether we have an accessibility to all the gadgets. So documents is something like we should have the appropriate documents we should have in complete ethical clearance, whether our institution will provide a complete ethical clearance, whether we have a complete standardized documents, if we are using any questionnaire in our study, whether it's a standardized one, or whether we need in a local language, whether we need to get the translation done out of this. It is not the translation I will sit and just make the translation. There's a format where we have different types of translations to be done. So whether that is an appropriate, that is a scientific way we are doing it, and statistics, whether we have a good statistics, we have a good knowledge about the statistics, we have a good knowledge about the numbers, as I already mentioned, the type of data we are collecting, whether we are aware of all these things, and whether we have all the statistical data like the number of population we are targeting, whether we have the exact statistics available with us. So this is very important. Once you know about this, this is called as feasibility. Second thing is interesting. One can explore this it and back it up with academic and intellectual debate. So once you are getting it, sometimes we just do that. It's a human tendency, and it's more over in India. We see that when I just take a research topic, I will not tell to my friend. Oh, if my friend asks, okay, what's your topic? No, pa, I have not just taken it yet. I'm still thinking of it. I don't know what exactly it is, but that's wrong. So it should be such an interesting where you have to explore this, you have to discuss it as an intellectual debate with your academic peer reviewers, with your peer friends, or with your teachers, or with your superiors, whoever it is. So that is very interesting. It should be more interesting. And third one, it should be novel. Whenever you're taking a research, the question should not be simply copy question or which has been already done by the investigators or the researchers in the previous research. You need to have the novelty of the research so that only it can produce evidence-based practice in the physiotherapy field. So, how we are going to check with the novelty, as I already said earlier, we need to check with the literature. We need to have the hierarchy from the higher to the lower as systematic from the systematic review. Then we can just find the gap in the study, which will be our question, which will can be the novelty of our research. And the fourth one is ethical research question. When we are taking, we should always see, I talk always about this ethical considerations because I have not only PhD, I have my fellowship in post bioethics and medical ethics, which was from the Gothenburg University, Germany, because there are many ethical considerations which is happening in day to day life in research and in clinical practices also. So no matter you are a researcher or you are an academician or you are a student, we need to be very, very careful about the ethical considerations when we are taking a research question. So we should be very, very cautious to know there should not be any harm to the participants when we are doing any research, and we should protect the privacy and maintain the confidentiality of the data. But to be honest, when we write the informed consent to submit to the ethical committee review, I'm the chairperson of the ethics committee review, and I go for the inspection to the ICMR guy with ICMR people as well. So when we check with the ethical issues in any research, we just cross check with the informed consent. So what the consent we see is that the researcher has mentioned there is no harm to the participant. But to be honest, my dear friends, whatever research we take, there is a harm, there is a potential harm. So we should always write that there is a minimum harm. Because, for example, when we are taking a good research and we are just giving them a simple questionnaire, so even the questionnaire also, some questions are that in that way that may hurt the person's dignity, that may hurt the people, right? So that also causes harm. So it is always advisable when we are writing an informed consent, we should not mention there is no harm, we should mention at least there is a minimum of harm. So, and we should always protect the privacy and maintain the confidentiality of the research. But if we talk about the ethics, it's a very vast, so I'm not just touching that part. So in short, I can say that ethical considerations are very, very important when you are taking a good research question. And next one is relevant. The question should be academic and intellectual interest to people in the field you have chosen to study. So it should be based on your academics and your intellectual field. So for example, we do masters, I have done my masters in pediatrics. So my interest should be towards my intellectual academic interest to the people, and I should contribute to the field what I have chosen. It should be relevant to the physiotherapy. That's what I can give the evidence based practice. Collaborative studies, in we collaborate with the other studies also, but we have other experts, but we are contributing from our field. So that is also very important. Ethics have come. So many of the research have been conducted in very high good journals, but the researchers are from different fraternity, but they have no knowledge about the physiotherapy. So in that way, in what way they have contributed their intellectual interest or intellectual knowledge to this particular field. So which is very, very important. So that's how when we chose the supervisor for the students, we chose the supervisor. For example, somebody is doing MPT in orthopedics, we choose an orthopedic lecturer or professor for the student. Same way it goes for the different elective as well. So it's very important you have should have an relevant and very intellectual knowledge towards the field. And the next one is manageable. Research should be always manageable. Sometimes, like what we do is, we at the end we are just going for the methodology is done, we have collected the data, but we have no time, the exam is ahead and we have no time to submit the thesis on time because we could not collect the data on time. So it should be manageable. A researcher has to always manage the timeline, what we call as Gantt chart. It should be always manageable. It should be always to put a timeline, this is the timeline I'm going to finish. So it is always important for a researcher to make it as a manageable. And appropriate. Appropriate is we should have a logical and scientifically appropriate content, and the community and the institution from where we are collecting the data. Right? Many studies are. It is very sad to say that many studies are happening in India, like where the falsification of data is happening. Like we don't have the data, but we just do the falsification of data and just submit the thesis. And sometimes many institutions, like the PhD students, are not doing the research, but finally they are just submitting the research. But at one point, what we say that which is not going to help our field, which is not going to give us any kind of intellectual or academic knowledge to explore our field, to give better to our field. So it should be always logical and it should be always scientifically appropriate. And the next one is potential value and publishability. You should have always clear implications for resolving important dilemmas in health and healthcare decisions. So we are doing the research, we are physiotherapists, we have done the bachelor's, we go for masters, we go for PhD, we do the research. PhDs, we go for postdoctoral fellows, we go for other fellowship courses, but overall, our main intention should be there. What we are going to resolve is what is the dilemma in health and healthcare, and what healthcare decisions we can give. So we should have an potential, we should give an potential value by giving good publications. Okay, so when we give the good publications, so if our research is good, research question is good, we have formulated the research in a very systematic way, in the good pyramid of a research, we have collected the literature from the evidence based practices from the good search engine. So obviously we are going to have a good importance of our research, and our goal will be fulfilled to give the healthcare decisions and to resolve the dilemmas in health. And the last one, it should be systematic, that is structured, well defined. It should be well defined structure. All right. So now, next one is how you start your journey towards research. So you must be asking yourself, what I'm going to study, where should I study, what should I do, how do I do, what do I do, when do I do, where do I do, and why do I do. This is what every researcher is come acrossing when they ask the questions to themselves. It is not only you, it is all the researchers, those who have succeeded in their academic or research career have faced the same. So I'm sitting in front of you talking very big about research, but I also have faced the same question. What I'm going to do? Where should I start? What I'm going to do? So it is everyone's journey. So this is how we start with our journey. So research question, when we are aiming for the research question, sorry, when we are aiming for the research question, we always aim, we need to explore some uncertainty in the area of concern. That's how you just create your research question. So when you're creating a research question, it always forms a backbone of the research question. So backbone of a good research, when you are publishing your research, you have done your work, you have worked very hard for your research, you have submitted your research. Now why to get it waste? Why don't you want to publish? Because when you are publishing it, then only it will reach to the research community, then only it will reach to the physiotherapy community to know what exactly we have done. And this is what we have proven is the best clinical based evidence, or this is what we have proven as a good research content, this is what we have proven as a systematic methodology. So we go for a publication. But for the publication, when you go for a publication, first thing is the editorial board, the editor will check whether the research question is good. So always think that research question, good research question is a backbone of good research. So you should formulate a very good research question, then only you can go ahead with the journey. So that's what you can just start, what I'm going to do now, who I'm going to take it for my participants, where I'm going to do, when I'm going to do, then what will be my contribution to the scientific community. So hence the formulation of a research question is always one of the first critical step in research process, especially in the field of health research, where the systematic generation of knowledge can be used to promote or to restore or to maintain and to protect the health of individuals and the population. So this is what, if you could see the thinking man here, the first man is the thinking man, the second thing is other researchers, he discuss with the other researchers, then he gets the relevance, that's your research, that finally it goes into the practice because you have proven this as an best clinical practice or best evidence based practice. Now, types of research questions. So we have a research question. There are different types of research questions. One is the descriptive, comparative, and the causal relationship, that is between two variables when we are having any kind of differences between the variables. I hope that master students have studied about the research methodology and the biomechanics, biostatistics, so it will be easy for them to understand. But I'm not sure about the BPT level students. But still, if you want, you have any doubts at the end, you can ask me, no worries about that. So descriptive, it is something like we are describing some questions. So for example, I've just given an example here is how many calories do Indians consume per week? So it isn't descriptive. We are just describing it. It is not a specific question. It's a descriptive question. So we can say that this is a descriptive study. My research question is a descriptive research question. And the second one is comparative, when you are comparing between two or more groups. For example, you want to check the differences of daily calories what Indian community is taking, but you want to compare between men and women, so it is called as comparative research question. The casual is something where you are checking for the relationship is something, for example, the question I have mentioned here is, what is the relationship between leisure time and the mental health among teens? So these are the two variables here. What we are assessing is the leisure time and the mental health. These are the two variables you are using, and you are checking the relationship between two variable type question. So these are the types of research question. You should know what exactly your question as well. So here are some common ways you can narrow down a research topic. So now we have formulated a research question. We are just narrowing down it to start with the topic. So first be the title. What should I mention in the title? But you know not to be worried about the title, because once your research question is strong, your objectives are strong, the research topic can be formulated at the end also based upon the keywords what you are using in your research. So, starting with the topic, you should not worry. You should just take the keywords which will help you out to find the literature, to find the methodology, to get the evidence based practices which is already published, and to support your standard methodology. So, those keywords you can use. Okay, so now you are narrowing and focusing your topic. How you are doing that now? So now, for example, you have taken the research question. For example, I've just given it's an example I'm giving you. Just you want to check the differences of quadriceps strengthening exercises, effect of quadriceps strengthening exercises in osteoporosis or osteoarthritis among Indian population, and you are checking with the male and female differences. What could be the effect in male and what could be the effect in female? And you have some age variations also. So this is what you are checking with the topic. So now you need to narrow down with the topic to focus on the topic. What is your relevant? So first thing is you need to check with the demographic characteristics. That is, you have to see, you are checking for the osteoarthritis, yes, but what age group? So you should narrow down the demographic characteristics, for example, age group, occupation. Okay, maybe osteoarthritis is more common in this particular occupation, so you'll be targeting that occupation. Ethnic group. So what ethnic group it is more important? Maybe it is more in South Indians, or it's more in North Indians, or it is more in this ethnic group. So you need to check with that, and the gender, whether it's more common in females or males, etc. So these are some of the demographic characteristics which you need to narrow down when you are taking a topic which is very general. So general is we have taken an osteoarthritis, but under osteoarthritis, you need to narrow down the specific characteristics as in demographic characteristics. The next one is the relevant issues. What are the relevant issues? You need to identify the key issues related to your topic. For example, that you have an opinion on, you can turn on your opinion to a thesis statement. For example, I've just given an example here is challenges faced by college graduates who are unable to find meaningful or relevant work. So this is something different. You are giving some kind of issues related to issues. So I'll just give an example related to physiotherapy only. For example, as I said, you are just giving an osteoarthritis. So osteoarthritis, we have taken, okay, this is the age group I'm focusing, this is the occupation, ethnic group, and gender. But what could be the relevant issue? What are the problems this osteoarthritis causes in this particular demographic characteristic? So you need to focus on that particular relevant issue. For example, maybe you would just want to check whether the range of motion. I don't have expertise in ortho. I'm just trying to just give it as a basic level. So it is like, maybe range of motion, or maybe the quality of life, or maybe some kind of muscle strength. So these are some relevant issues which you need to target in your topic. And the third one is location is what community you are focusing. For example, I mentioned here a specific country. Sometimes the researchers are conducting in different countries, and we want to conduct the same study in our country. So we need to focus in our country. For example, my study, I have done my PhD study in pediatric scoliosis, where my study participants were prepubertal girls. it was conducted in South India, but that was the first study we conducted in India. So the study was conducted in other countries, but my study was the first study to be focused in India. For that, we had to collect a specific location. Then I had to check with the provenance. I had to check with the environment. I had to check with the pilot study and other things, whether I'm targeting the rural or urban. There are many challenges what we face when we are targeting the particular location when it is done first time in that particular country. But when it is done in other locations also, but you need to check what specific country or what specific provenance I'm going to target, which also should be highlighted in your topic. It also should be highlighted in your research questions, and which should be highlighted in your objectives which you are formulating for your research. So by time frame, so you need to decide whether you want to study the recent events or the historical time period. This will help you to decide how current the information you have, you must be seen. For example, like you should have a time frame. For example, the earlier studies, you need to check how long they have taken. What is the data collection time? How long I can do it? For example, you are just collecting the osteoarthritis data for from Coimbatore for females, those who are homemakers, housewives. So you need to know like how I'm going to take the consent from those females. How is the time frame? How I'm going to give them the intervention? It should be time framed as per your study. It should be time framed in within you, so that only you can just formulate a good topic and do research as well. And by causes, you should know actually why do employers hire fewer college graduates. So causes, like you should have an perspective of looking for the cause of an issue. For example, we say that yes, osteoarthritic patients, they have a very poor quality of life. We can say, I just want to take a study. What is the quality of life among females in Coimbatore, those who are having osteoarthritis? But you should know the cause. What exactly is the cause, due to which cause their health related quality of life has been affected. So these are some common ways you can narrow down the research topic, which is generic, into the specific. And when you are taking in a specific way, which gives a good frame of research question, and which really gives us a good research question and the good research pyramid, and till end whatever you are publishing your research or submitting as a thesis. So the research question is, for if you see that the left hand side, some cross marks I have put and some tick marks I have put. So the how we have to make the research question. Sometimes when we just make the research questions and we just write, is it going to be, what will be the effect of this? Why is it like that? So many students do that, but it is not the way when we put the research question. When we put the research question, or we go for an aims of the research, or we go for an objectives of the research to formulate, we should always use the transition words. Okay, the transition words are something like to determine, to access, to investigate, or something like that we need to put, so that we can have a good start to frame our research question. So here the first question what they have reframed is, what effect does social media have on people's mind? So it is a general question what can be asked, but it cannot be a research question, because we need to check with all the previous considerations, the previous slide which I show you, the demographic characteristics, the location, the other things. So the next one is put the question in a rightly way based upon the considerations in the previous slide. For example, what effect does daily use of Twitter has on the attention span of under 16? So you can just see the difference, how good and how specific the question looks like. So next one is, why is there a housing crisis in the Netherlands? So it is a general question which can be asked in our debate or in our daily life, but it cannot be asked as a research question. So what it can put in such a way that we can just write in such a way like that, what impact has university internationalization policies had on the availability and affordability of housing in the Netherlands? So housing criteria in the Netherlands, there can be their own citizens, or there can be some other international people also. This is not specific. They are mentioned inter housing crisis for where? So if we just put it in very specific way, what location, what gender, what ethnicity we are putting, so this is how we need to put the research question. So I'm not just reading all. If you want, you can take the screenshot of this. All right. Now, next one is the brainstorm concept of formulating research question. So first thing is the research question should be clear. As I mentioned in the earlier question, earlier slide, how it should be clear, and based upon the previous slide, how we have to know about the characteristics. And it should be focused, concise, complex, and arguable. It should be arguable. So your research is your baby. You are taking care of your baby, and you should be confident enough to have an argue related to your research, to have a debate related to your research. When we go for a research, when you just go for as an PhD scholar or the PhD person, when we go for a public defense, I think many of the PhDs are there sitting there, and they can just recall their memory. When we go for a public defense, we are bombarded with many questions because people are just checking our research the first time, but we have spent in this research for around 4 to 5 years. But we should be confident enough to defend ourselves, to argue our research, what exactly we are going to do. So it is the way it is applicable for all the researchers, no matter you are at graduate level, you are at bachelor or master level. You should be always having a clear cut idea about research, where you can have an arguable debate with any of your peer reviewer or anyone of who is having any debate on your research question. The second question, what you concept you should follow when you are having a good research based upon the evidence based practice, is you need to identify the types of research which has been done in the past, which I earlier mentioned. You need to follow the pyramid. That is, you need to follow the evidence based practice based upon the hierarchy. Okay. And you should identify at least 20 cited articles which have been cited, not the which has been published in the predatory journals. And minimum should be 20 recent articles which are published in the recent 5 years. Those are called as recent articles. And you should be always there a unique area to find whether the investigation of this particular question may be worth replicating, whether I'm just doing this replication of this particular question in by different means, I'm just giving a different frame to this question, but whether it is worth to give contribution to the scientific community as an evidence based practice. So we need to begin and narrow down the topic, as I mentioned earlier, how we need to take care of the characteristics, and we should evaluate the question, then we should formulate an hypothesis, then we have to write an effective research question, which I gave you an earlier examples also. And the second format, what we follow is the Pikett format. It's a principle, what we call is in research is in Pikett principle. So Pikett is P is population or the problem, or if you're targeting a patient, I is intervention, and what variables you are targeting in that, and C is comparison, whether you are having any comparative. For example, in the research question type, I told you about the comparative type. So whether it's a comparative, if not, then it's descriptive. Then O is outcome. What outcome you are producing? You need to know what exactly is the measurement tools I'm using for my study, and what could be the outcome of this, which is very important to produce an evidence-based practice. And the time, whether it is a feasible time for me, whether I could produce the research publication on time. For example, if you're just taking a research which is too lengthy, which has got no worth, you are just conducting the research for 3 years, by already the evidences of that particular question have been published 2 years back. So there is no worth, there is no point of you conducting a research. So there should be a time limitation in that. So if you see that example I have given here is, do first year medical students who complete a student run anatomy review course higher on the anatomy final exam than students who do not compare the review course. So this is like what population we are targeting here. The P is the population here are first year students, or if you are having any patient, for example osteoarthritic patients, those who are coming to your outpatient clinic, or those who are coming to the hospital. So your population will be osteoporosis, osteoarthritic patients. But here the population is first year medical students, not only medical students, first year medical students, because we have to be very, very specific when we are putting a research question. So what is the intervention here is completing the review. So intervention is when they are completing the anatomy review. That is our intervention here. So for example, you are giving intervention in your research is, for example, you are giving the quadriceps strengthening exercises to check the variables between two variables. For example, the quality of life, or you want to check whether the pain has been subsided. So these are the two variables. So that is the intervention you are using. And the control is when you don't have students to control. Here there are no control students, but if you are having the comparative, for example, you are comparing with one gender to the other gender, or you are comparing with one age group to the other age group, so you are having the comparison as well. So outcome is the final score. What will be your expected outcome based upon your intervention, based upon the measurement tools you have used in your study, and finally the time. So now coming to the hypothesis, when you are formulating a research question, we never know like whether our research question is going to support us or not, because we have just formulated a research question, we have formulated in our mind, we are starting with the scientific reviews, and we have formulated the methodology design, but we don't know what will be our findings, what will be, whether it will be significant or it will be insignificant. All right, so in that way we are creating an hypothesis. Hypothesis is something like a prediction. So when we write, we just write the predictions, hypothesis, null hypothesis in our research, right? So this you must be knowing about this. So research question, like it should be have an flexible work arrangements, like you should have an hypothesis, you should have a null hypothesis also in your study. And one more thing I just want to address here is, sometimes when we, not sometimes, when a researcher is conducting a study, mainly it happens with the student community. So when they collect the data and they go for an analysis, so they find that there are no significant differences. My research is going to be very bad, it is not supporting my hypothesis. What I'm going to do, my research, my supervisor is going to bombard me, my research is going to be rejected. But don't worry about that. We, whatever results you are, if your research is supporting your null hypothesis, that also is a good research, because you are supporting something which is not in supporting the evidence based practice, which can be stopped in the physiotherapy fraternity to give that particular exercise, because it has got no worth, it has got no clinical implications. So you don't have to worry about your research whether it is supporting null hypothesis or hypothesis, your significant results or it is insignificant results. So you should be always transparent and genuine to give the results based upon the findings. Okay, the objectives, types of research objectives can be the general objectives and it can be the specific objectives. The general objectives is something where we are having the objectives in general, and specific objectives when we are like having the objectives in specific. For example, we want to have some specific problem to look into, like for example, osteoarthritis among females, among in 40 years of age or in 50 years of age. So that can be the specific. So already the objectives also should be very specific, and you are taking a good research. So I'm not going to read all, maybe I have just exceeded the time. So research objectives, it should be clearly defined by the researcher in the right direction, and it should have a good importance and focus of the study. Sometimes the research objectives are not matching with the research question, and it is not matching with the research title, which gives us a very bad research pyramid. So we should always have a focus, we should have a connectivity between the research question, research objectives, and the methodology what we are taking. So it should be guideline what we have to follow. So it should be like, first we need to focus on the good research question, the good research objective, which we have already done. So second thing is, when we are creating the research objective, we need to formulate the research objectives in such a way which facilitates our research methodology. For example, phase wise, if we are taking one research phase one, we should know how we are collecting the data, how we are analyzing the data, how the interpretation of the data is done, and finally how the utilization of the data is done. So this is very important for the research question. So brainstorm, define the focus of your study, you have to define your measures, you have to indicate what are the steps you are doing, and you should know what are the limits of your study, and you should always avoid the collection of any data which is not necessarily. So whatever data is required for your study should be collected in such a way. So Choosing a good research topic, as I already said, so how we are finding the bias. So this I'm not going to take, only this one I will just take is about by what means of literature review. As I already said, these are the means we can create a good research, we can create a good research question, and we can create a good level of evidence by going to the pyramid, research pyramid, and we can identify the bias. We can just identify whether there was any conflict of interest, whether there was wrong sampling, whether there was positive result, whether there was any missing data. So based upon that only we can have a critical appraisal of in previous articles which have been already produced as an evidence based practice, and based upon that only we can formulate our research question, which I already mentioned earlier, how we have to make the research question, then finally make our research objectives, and when we are completing our study, so that is going to be a good and genuine evidence based practice. So this is what is about the structured evidence based practice. So thank you so much,